what do you say to somebody that says, I've tried the patch, I've been on it for 3 days, could be a week, could be a month, I don't feel anything. Is there something going on with them? Because everyone that I've seen diligently be on the X39 has been getting results. Can you tell us what's going on for maybe a simple answer for them to help their friend if they are just skeptical, not cynical, but skeptical?
Yeah, so absolutely. So at this point, we've done over 80 clinical studies over the last 20 years on the products. And so when someone says they have not experienced an effect, there is going to be an extremely small percentage of people. I mean, we're talking about 3 or 4% of the population that will not get an effect. Now, that effect is measurable. So if we have 96 or 97% of the population responding, that means it's measurable scientifically. That could be through a blood test, a urine test, bioelectrical test, and so forth. So in our studies, which we publish and which hit statistical significance, it means, let's say in the case of X39, is that we measured levels of copper peptide in the blood, and we were able to see increases in those levels of copper peptide. That doesn't mean you feel it, but statistically we can say that with confidence. So then we follow that up with another study such as a urine test, and we're going to measure the metabolism. So we look at how is the body utilizing amino acids, what hormonal changes might we see with X39, and those things also we hit statistical significance. We also use clinically relevant questionnaires, and we ask people, how do you sleep, how do you feel, overall wellness, and again, we see statistical significance. So the answer to this is that first, when people use the product, the odds are that it's making a change. They may not necessarily feel it. Now, if we think about the way stem cells work in the body, this was discovered at Sanford Burnham in La Jolla, California. What happens is that when a person has an injury, first there's a release of oxidative stress, then inflammatory cytokines, and those inflammatory cytokines are signaling molecules for stem cells. So the stem cells are attracted to inflammation. And what happens is a couple of things. First, we normally think about oxidative stress as a bad thing, but the fact of the matter is that it's there to decrease or kill off the bacteria. So you get an injury, and now the body kicks in mechanisms to prevent you from getting an infection. The inflammation is there, so you can make way for healthy tissue. So wound healing can begin, and then the stem cells go in and start producing collagen and growth factors. But as people get older and their antioxidant systems become depleted, the ability of the body to remove that inflammation declines, and now the inflammatory cytokines kill off the stem cells, and now people are left with these chronic injuries. So for wound healing, it's really very simple. We get the inflammation under control, we increase the number of circulating stem cells, we drive those stem cells over to the injury site. So let's say somebody says, well, I have this knee pain, and I used X39 for a month, the knee pain hasn't gone away. Well, this is because they have a higher degree of inflammation in a different part of their body, maybe their shoulder or their lower back. And if you ask them, they're going to say, well, yeah, now that you say it, that lower back pain I've had for 20 years is gone, right? So it's very important that before people start using the products, that they take before-after photos, they get an assessment of how their body's feeling, where the aches and pains are, their medical history, so they can be aware of some of these injuries, and then after a month, 2 months, they start to see the changes.
Wow. So that's 97% are going to see results if they stay on the X39